Hello everybody, my name is Dr. Srinivasan Rajappa and I work in Apollo Spectra hospitals as a hand and upper limb surgeon. I have had special training in CMC Vellore, in Ganga Hospital in Coimbatore and then in Singapore. So at the outset I would like to tell you what exactly hand surgery is about. Now hand surgery is surgery from the fingertip right up to the shoulder. Now this will encompass everything starting from hand injuries to arthritis of the hand to conditions like trigger digits, pinched nerves, which is commonly called carpal tunnel syndrome, or pinched nerves around the elbow, which is called cubital tunnel syndrome, fractures of the wrist, the elbow and the shoulder, sport injuries of the wrist, open crush injuries of the hand, nerve problems of the upper limb, brachial plexus injuries, which is basically a trauma to the nerves coming to the upper limb from the spinal cord, which can leave the entire upper limb paralyzed. So this is a little bit of a list of what a hand and an upper limb surgeon does. Today we will specifically concentrate on problems of the wrist and what wrist arthroscopy can do for it. In my opinion, wrist arthroscopy has revolutionized the management of problems of the wrist. Now what exactly is an arthroscope? Arthroscope is basically a keyhole surgery of the wrist. As it is always done in the knee as well as in the shoulder, so we make a small cut which is about less than a centimeter here, and we put a camera inside the wrist and do the surgery through that camera and maybe another hole on this side. The major advantage of doing wrist arthroscopy is that instead of making big cuts which used to be done, which means a cut extending from here right up to here, many operations can be done through this keyhole. Now this ensures very quick recovery, the pain is very less, and you can get back to your pre-injury activity quite rapidly. The next question is, when do we do wrist arthroscopy? Wrist arthroscopy can be done for a variety of indications, starting from scaphoid fractures, fractures of the wrist where you need arthroscopic assistance, sport injuries of the wrist, the most common one being the TFCC injury, which is a ligament injury on the inner side of the wrist, which is very, very common in sports. Wrist arthroscopy can also be done for conditions like Kienbock's disease, where one of the bones in the wrist has lost its blood supply and that bone needs to be removed. Ganglions of the wrist, which is again a very common problem, can be dealt with through the arthroscope, preventing a very ugly scar on this side or on this side and ensuring quite a rapid recovery. The advantage of wrist arthroscopy, as I mentioned, is quite a rapid recovery because of the small incisions we used, the relatively or negligible amount of pain, and a very smooth post-operative period. And not to mention the fact that the expenditure for wrist arthroscopy and open surgery is pretty much the same. So that's again a very important advantage as far as wrist arthroscopy is concerned.
So when can I go back to my pre-injury activity?
Now you can go back to your pre-injury activity depending on what surgery we have done in your wrist.
Okay.
Say for example, I was telling you about a ligament repair here. Now if you have had that ligament repair, then you can go back to your pre-injury activity in about 1.5 to 2 months.
Okay. So how frequently I should visit the hospital after post-op?
Now usually in the post-operative period, you visit the hospital twice in a matter of 1 month. Then after that you will have to come back for physiotherapy, which needs to be supervised for you to get excellent recovery of function.
Sir, is the surgery painful?
The surgery is got very little pain. Compared to open surgery, the pain will be only about 5 to 10%.
So what kind of anesthesia is used, sir?
The anesthesia can either be general anesthesia, which is putting you to sleep, or there can be an injection at the level of the neck, which will make the entire upper limb numb, but you will be awake.
So the advantages of Frist surgery compared to the open, sir?
Now, advantages is, the first advantage is that you don't make a big incision. The cut you make is very, very small, maybe less than a centimeter on this side and less than a centimeter on this side. So you're not going to have much of a scar. The second thing, as I mentioned, is very little pain. The third thing is quite rapid recovery in the post-operative period. And finally, it's not very expensive compared to open surgery.
So will the patient have any nerve damage or something, sir?
There's a very, very minimal risk of nerve damage, almost negligible, if not nothing. So you don't have to worry about nerve damage.
Sir, is there any precautions I should take after post-op thing?
The post-operative precautions will be advised depending on the operation you have undergone. So that is best decided by the surgeon as soon as the operation is over. But irrespective of what operation has been done, the recovery is going to be much smoother compared to open surgery.
So when can I lift the heavy objects?
Now you will be again able to lift heavy objects depending on the operation you have done, but usually most wrist arthroscopy patients can do heavy lifting and other gym activities by about 6 to 8 months.
Is there any specific food I should take for this?
There's no restrictions on food. You can eat whatever you want, whatever you like. Today we will also talk about common hand surgical problems. The first problem, which is very, very common, is called carpal tunnel syndrome, which is a nerve which comes from the forearm. It comes into the hand and it gives a sensation to the thumb, index finger, middle finger and half of the ring finger. Now in patients who are diabetics and patients who have thyroid disease, this nerve can get pinched here at the level of the wrist, producing a lot of tingling and numbness in the hand, weakness and pain and so on and so forth. This can be very disabling. Now, if you come to us, we initially evaluate you for an underlying uncontrolled problem like an uncontrolled diabetes or thyroid disease. We give you splints and we give you medication for the nerve to recover and physiotherapy for the nerve to glide. Now, in case all these things don't work, we can do surgery to correct this problem, which results in very good relief of symptoms. And this surgery can again be done through what is called an endoscope, which again is a camera assisted operation. Now previously the incision used to be from here to here, and that you go underneath and release the nerve. But now you can do an incision about 1 centimeter on this side. You can put a camera inside and do the same operation. And this results in rapid recovery of function, and you can get back to most things you were doing before the operation quite rapidly. The second condition you need to know is what is called trigger digits. This is very common among senior citizens, especially again in diabetics. It usually affects the ring finger, but it can also affect other fingers, especially the thumb. Now what happens is that the finger bends like that and it gets stuck like that. It is very, very painful for you to release it. There's also quite a significant amount of pain on this part of the hand, which makes it very difficult for you to grip anything. Again, this problem can be treated initially with physiotherapy and proper splinting and exercises. If it does not work, a small steroid injection here can be given. You don't have to worry about that steroid injection because the systemic absorption and the side effects of the steroid injection are almost negligible. If nothing works, then again through a very small incision, this whole problem can be sorted out by releasing the tight structure, and you can go back to most things in a couple of weeks. The next problem, which is very, very common in the wrist, is a tendinitis, which means as we move the thumb up, you can see the tendons of the thumb coming up, and that can get very tight here. Now, people who have this problem find it very difficult to carry something with their elbow bent. They find it difficult to pinch objects and hold anything tight. That is because a tendon is very tight on this side of the wrist. Again, This can be initially treated with medication, proper splinting and physiotherapy, and if it does not work, a very small operation can correct it, and you can have fantastic pain relief which will enable you to go back to most things as before the problem started.
Sir, is it safe for pediatric age group to have the surgery, sir?
It is very, very safe for pediatric patients to have wrist and hand surgery. The problems of the hand and wrist in the pediatric age group are very exclusive. For example, children have congenital hand problems, which means the thumb is missing. The second problem which is common in children is what is called a trigger thumb. They have a bent thumb like this and they can't straighten it out. The third problem which children can have is the fingers are joined either fully or at the tip. Of course, children are also very prone for injuries and they can get their fingertips injured indoors. They can have fractures like adults, and these are the common problems we face in children.
Sir, is cast needed after the surgery, sir?
Now, sometimes cast is necessary to protect the fracture or protect the repair, but sometimes it is not necessary. Again, this is an individual decision based on what is the operation and what the surgeon felt during the operation.
Sir, is there any risk of thrombophlebitis, sir?
There's absolutely no risk of thrombophlebitis during any of these procedures.
So, how long is the tendon recovery period, sir?
If we are talking about tendon release surgery, then the recovery period is within 24 to 48 hours. You have a dressing change and then the wound is left open, and then you start using the hand as much or if not more than before. On the other hand, if it is a tendon transfer operation or a tendon repair operation, then the rehabilitation is slightly more prolonged.
So, for who the surgery is contraindicated, sir?
There's really no contraindication for the surgery unless otherwise there is an anesthetic contraindication, or the patient does not want the surgery, or there's no match between what the surgeon can offer and what the patient expects. Otherwise, there's really no contraindication from a hand or wrist surgery point of view. The surgical problem we need to be aware of is what is called brachial plexus injuries. Now, brachial plexus is all the nerves which come to the upper limb from the spinal cord. As they come to the upper limb, they sort of innervate all the muscles in the upper limb which make the upper limb move. Shoulder, elbow, fingers and wrist. They also give the sensation to the entire upper limb. During unfortunate accidents, these nerves can get injured, leaving the patient very debilitated and incapacitated. So, if detected early, these nerves can be reconstructed and a reasonable amount of function can be restored after the operation. However, it is important for the patient to approach us early after the injury so that precious time is not wasted for the surgery to be performed. So, if the surgery is performed at a reasonably early time, then the success rates of this operation is pretty good. It's important to know that the wrist joint has got two major bones on the forearm side, and it's got multiple small bones. All this constitute to form the wrist joint. One of the bones on the thumb side of the wrist is called the scaphoid bone. The scaphoid bone is notorious in many ways. If somebody has a fracture of the scaphoid bone, it's usually not because of a very high velocity injury like fractures in other bones. A fracture of the scaphoid can happen because somebody just fell on the hand, and usually it does not manifest as a major amount of swelling or a difficulty in moving the hand. Now, this is one of the reasons why it takes a while for patients to seek medical attention for these injuries. And when they seek medical attention, a considerable amount of time has been wasted in detecting this fracture, which leads to problems in both treatment and to provide satisfactory outcomes. So the first thing is, if you have had an injury on the football field and you have a certain amount of pain in the wrist which you think is wrist sprain, please consult a hand surgeon before you make a decision that there is nothing, so that a fracture of the scaphoid will not be missed. The second thing about this fracture is that this is a very difficult fracture to join. That is because of the way the blood supply of this bone is, which makes it quite challenging even if it is detected early for the fracture to be treated. But however, if it is detected early, that is the best chance of this bone to be treated very well. Now, if you have a fracture of the scaphoid and you present to the doctor late, we usually do an operation where we open the scaphoid up, we freshen the fracture surfaces, and we pack that area with bone which is taken either from the wrist or it can also be taken from your hip joint, and it is packed there and it is fixed with wires. Now, please do not worry about a small piece of bone being taken from the hip joint. It usually has no problems at all, because most patients, when you tell them about this problem, they are very, very concerned about many problems which they think will happen, but you can be rest assured that nothing really happens when a small piece of bone is taken from there. Now, the fracture usually takes about 6 to 8 months to unite. The movements of the wrist are started in about 2 months after the operation. Till that time, the patient has a plaster extending from here to the upper of the forearm. After that, the success rate of this operation is close to 80 to 90%. Of course, 10% can run into trouble with the fracture not uniting and having consequences.
So when can I drive the vehicle, sir, after the surgery?
After scaphoid fracture surgery, you can drive the vehicle in about 6 months.
Okay. So can you feel the screws in the...
You will not feel the screws because the screws are inside the bone. Sometimes we fix the fracture with wires which are usually removed once a fracture unites. Now we will talk about a ligament injury on the wrist, on the inner side of the wrist, which is called the TFCC. This is again a very, very common problem when people play sport, especially when they fall, when they play racket sports, or when they, in non-sporting incidents like lifting a heavy weight, especially in the airport when the suitcase comes off the belt. Now this usually presents as pain on the little finger side of the wrist. When the patient rotates the forearm, it usually is very, very painful. Diagnosis of this problem is made by doing a detailed clinical examination. Subsequently, X-rays are done, and when an MRI scan is done, we get a lot of information about where the tear of the ligament is and so on and so forth. Initially, this problem is treated in a plaster or in a splint with restriction of activity and pain medication. Usually, this treatment is successful in about 80 to 90% of patients. In situations where this treatment is not successful, arthroscopic surgery of the wrist comes in very handy, where we put a camera inside the wrist joint and we clearly find out where the tear is. So once the tear is found out, the tear can be repaired through the keyhole, and then the recovery can be very, very rapid. The advantage is that this surgery is very successful. This operation is done through the keyhole. You don't need a big incision for it, and the pain in the post-operative period is very, very minimal. So you can get back to most of the sporting activities in about 3 to 4 months. Gentle activities of the hand like getting dressed, washing yourself, using a computer, using your phone, drinking with a glass of water can be done quite early.
So is it really safe for kidney and heart patients, sir?
This operation is very, very safe for most people, so there's really no contraindication at all.
So how successful is the surgery, sir?
The success rates for this is about 90 to 95%.
So how can I strengthen my wrist?
A strengthening of the wrist can be done first initially is to get good range of motion. Once range of motion is achieved, then the strengthening is usually done with, first is to start with very little weight, maybe 1 kilo dumbbell or a very least resistance band, and then as the strength becomes better and the pain is tolerated, we progressively increase the amount of resistance and the amount of weight. And of course, what kind of exercise is necessary is tailored to the patient, the underlying disorder, what operation the patient has had.
So how much does the wrist arthroscopy cost in India, sir?
Now in India, the wrist arthroscopic surgery usually costs about 1.5 to 2 lakhs, inclusive of all charges.